and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or ARC IPC. My name is Mina Nabavi, and I'm a program manager with the ARC IPC at the University of Alabama at Birmingham School of Public Health. The American Academy of Pediatrics recommends COVID-19 vaccination for most children and adolescents 5 years of age and older. However, as of April 13, 2022, only 28% of children ages 5 through 11 and 58% of adolescents ages 12 through 17 have received the 2-dose vaccination series. Now, throughout the pandemic, having conversations around COVID-19 and this vaccination has been challenging, especially when it comes to our children. To share her thoughts on the COVID-19 vaccine and children, and how to have these conversations around the vaccine, we have invited back Dr. Candice Dye, an associate professor at the University of Alabama at Birmingham, and an academic general pediatrician at Children's of Alabama to join us. So thank you for being here, Dr. Dye.
Absolutely. Thank you for having me back.
So it seems that families are maybe more willing to vaccinate older children, that 12 to 17 year age, rather than younger children, the 5 to 11 year age, based on those vaccination rates that I just shared a second ago. Why do you think that is?
You know, it's kind of hard to really understand some of those differences there. But I think one kind of thought is that the children in that older age group, that preteen and teens, have been getting vaccines their whole life. Around that 9 to 11 year age kind of group, they get boosters on several of the childhood vaccines and a new one as well for that age or for that timing. But versus the younger kids who should have been vaccinated throughout their first year of life and then around 4 years of age as well, they haven't had vaccines in a while and or needed them, per the recommendations. And so, I think part of it may just be that there's just that hesitancy of, well, why do they, need this at this young age versus the older pediatric population, where it maybe seems a little bit more routine at that point for them to need a subsequent vaccine.
I think that's a great point that you make. I have a 1-year-old, so it seems like every time we go to the pediatrician for a checkup, she's getting vaccinations. But you're right, that age range, that 5 to 11, they may be out of habit from getting vaccinations every visit. So
right, hopefully they're getting an annual flu vaccine, but right, it's not that they've been getting it at 2 months, 4 months, 6 months, and then have this 9 to 11 age. And so it's hard to know for sure, but I think that's probably one thought. And I think one of the other things too is that it's, the younger children, depending on what vaccine, are often maybe the last to get that approval. And so the older population, adults, and then, moving down, have been approved or have gotten that vaccine. And so it's just that gap on when the children are eligible as well. So,
well, that leads in nicely to my next question, which is, as a pediatrician, what are some common questions or concerns that you hear from patients and families about pediatric COVID-19 vaccines?
Yeah, and I think it's just, again, that it can be, different for different people. I think and hope that parents and caregivers truly want what is best for their child, and they want it to be proven and safe And a lot of times the questions revolve around that. Just simply, is it safe for my child to be vaccinated? And I want them to ask that question to their pediatrician, to their medical provider. Again, as we touched on last time, there is so much misinformation out there and so much disinformation. I've just really, really encouraged them to go to the expert and to the person that they trust for their child's care to have those conversations, and just be open about that.
So I know, parents have repeatedly heard that COVID-19 does not impact kids as severely as adults. And, especially if, a family has been impacted by COVID-19, kids may get it and just keep on going while the adults may be sicker for longer. But should children, even healthy children, get vaccinated against COVID-19?
Yes. And hopefully they don't get as sick as the elderly or an older person, or just even an adult that has chronic conditions. But there still are immunocompromised children. There are still children that have equivalent of those diseases and illnesses that adults do that make them so much more vulnerable. They need that protection. They may not get as sick, hopefully they don't, but they still do get infected. And part of that too is that if they're infected, and yes, hopefully they are, that percentage that is doing fine and able to, pretty much keep up their normal, they're around other people who can't, and would be severely devastating and even deadly if they expose those individuals.
So a follow-up to that, if a child has had COVID previously, do they still need the vaccine? A parent may say, well, my child has had COVID, they have the antibodies, why would they need to get the vaccine?
Because they can still get infected, and the immunity that you gain from having the infection may protect you for a short term, but the vaccine is going to give you a better immune protection and for a longer duration.
I know we didn't talk about this before we started recording this podcast, but do you have any guidance on how long someone should wait to get a vaccine if they've been previously infected, had COVID-19? What's the recommended time that they should wait before getting a COVID-19 vaccine, that a child should wait?
Right. And so that has changed throughout this pandemic, as we, again, have rapidly been learning, digesting, and processing. The most recent is that once that child is recovering and not needing intensive care, they can be vaccinated.
So do you have any tips as a pediatrician for how to have conversations with people who may have different views about vaccination? Sometimes you start to have a conversation and people may go on the attack mode, and sometimes people may just decide to shut down. I'm sure you face that as a pediatrician, but do you have any tips for parents or caregivers of what they should do if they're trying to have conversations about, vaccinations?
Yeah, thank you for asking that. And I think it's like with any other conversation where you may have, differences. If you jump in, like you said, go in on the attack, then it's not going to end well. And if you go in with that, knowing that, of course, everybody has their right to their thoughts, but actually listen to what they are saying. and then talk with them, not at them. You're not going to get anywhere by being condescending, demeaning, and just immediately on the attack and defense. And it does not end well like that. But truly having that open conversation and, just what have you heard? What do you think? And then, well, let me explain for a minute of what I know and, what I think. And let's talk about how those things, can align and what's, finding the common and the truth there.
And switching gears kind of as we wrap up, I know when we've been talking about, talking and having conversations about vaccinations, at least I've been thinking about, adults to adults, but, how should parents talk to their children about COVID-19 and the vaccine? I know shots are scary for children, and especially since we've been living in this time for the past 2 years where this is all you see on TV. This is all you hear about on the news. Do you have any tips or advice for parents on how to talk to their children about this vaccination?
Absolutely. You let them lead. Like with anything else, they ask a question or they have a concern, and ask them in response, well, what do you think about that? Or what do you think? What are your thoughts on that? Because where you think they may be going, oftentimes is nowhere near where they're going. And I personally, as a pediatrician, as a mother, I have to be real careful about getting way into the weeds when all they wanted to know what color the sign was, not, what the sign meant and where it was telling us to go. And that's maybe not the best analogy there, but let them lead and let them explain to you what they think or what they understand. And then you're able to more meet them where they are to help answer what they are really asking and really wanting to know. Be truthful with them too. It kind of undoes me when a caregiver will say, you behave or you're going to get a shot. Well, no, it's not a punishment. It's, this is to protect you and to protect those that we love and help keep you healthy so that you can grow and thrive. And yes, it is a poke. It is, maybe not going to feel the best, but a short-term, poke and a little bit of pain there at the site for the longer term, gains of it. And again, depending on how old the children are, that may not even resonate with them. So you let them lead and hear them, empathize with them, and just, again, meet them where they are.
I love that. And I think, like you said, that can apply to so many different things, not just around COVID-19 and vaccination, but around lots of other topics that children may have questions about. So I like that. Let them lead.
Yeah. And like you said, that's true with, on that previous question. What do they understand with adults or anybody? So don't hide things too. You need to explain what they are asking, but you don't have to give them the, dissertation on it, because first of all, they're going to tune out at about 2.2 seconds. So.
Right. Exactly. Well, thank you so much, Dr. Dye. This has been a great, very timely and informative podcast. You've provided a lot of great information about the vaccine, and we've had a great conversation about how to have good conversations about the COVID-19 vaccine. So thank you so much for recording with me today.
Absolutely. Thank you. And, just kind of a closing comment is that, sometimes these conversations are difficult, but if you don't ever have the conversation, then it's way more difficult. So just, having that open dialogue is just hugely important with your provider and the provider with the patient. So
I agree. That's the first step, starting that conversation.
Yeah.
And thank you to our listeners. Please tune in next time for another episode from Standard Precautions and Beyond, Conversations in Infection Prevention and Control.